Well, we want to welcome everyone to Unsaid. I am Katie Whiting, your host and your mental health specialist, and we are here to continue our fabulous mini series on what we're discovering is perimenopause, but really this transition into midlife. And we are so grateful and honored today to have Dr. Shayla with us. I'm so excited to hear from you. But Dr.
Yeah.
Shayla, I've seen your bio on your website and I've talked to you, and you have a plethora of experience, I should say. So why don't you just, for our listeners, introduce yourself, what you want to share, and then we'll dive into our topic.
Yeah, for sure. So thanks for having me, Katie. I'm
Yeah.
excited to be on your show. Yeah, so I am a board certified physician. I'm certified in both family medicine and obesity medicine, but then I've also had additional training. I have a certificate of plant-based nutrition. I am a certified menopause society practitioner, as well as additional training in functional medicine. And so I've combined all of that, and I practice within a integrative health aspect at my own clinic, which is Essence of Health Wellness Clinic in Chattanooga, where I see a variety, mostly women who are looking to prevent and reverse chronic health conditions, heal their hormonal conditions, lose weight, and we do that in a more holistic way. So
That's
happy to be here.
amazing. Yeah, thank you. We're so glad to have you. Well, in all honesty, as I gave you a little intro before, the listeners have been going through multiple providers, multiple resources, sort of answering like, what's happening to our bodies and what can we do about it so there's not this crazy misery or breakdown or, whatever the symptoms may be. So just give us, through your scope of practice, like, we can call it perimenopause or whatever you want, but this transition right into midlife, into menopause, like, what do you see it as?
Yeah, yeah. So typically, I like to remind folks, especially, we as women, we are not, in this box. So for all of us, this can look differently. What your friend may be experiencing, you may or may not, and vice versa. But a lot of the time, what I'll see, women come in and they say, "Well, I'm tired. I'm more tired than I used to be." Or gaining weight. I've been eating, the same way that I've been doing over time, but now I seem to be gaining weight and I just can't lose weight. Or I'm putting the keys down and I can't remember where I put them. Getting some of
Yeah.
that brain fog stuff. Or even some sexual dysfunction symptoms, feeling more vaginal dryness or more UTIs. So it can, really come at us just a variety of ways. But, and one of the reasons why I even open Essence of Health is to be able to spend more time with my patients. And so it does, it takes that time to really sit and talk through it to say, hey, it may not necessarily be that, but it may be this. And so that we can look at this, from a number of different lenses so that we really can get down to the root of what's going on.
Yeah, absolutely. Which is, thank you for starting with that, because I think what I'm learning through this journey of interviewing all of these amazing experts is it's not just like, I mean, perimenopause is big, right? But it's not just one thing. It's the whole storyline, like
Right.
from head to toe
Right.
and your history,
Yeah.
right?
Yeah, 'cause I feel like, so many of us equate menopause to, your auntie or your grandma having hot flashes, and so you think, they're all of a sudden everybody's freezing because, auntie turned on the fans
That's
or
right.
whatever, but
That's right.
there's so much more there than
Yeah.
that. That's just, one aspect of it, and there's just so much more there.
Yeah, that's hilarious and so true. Yeah, we'd all be
Yeah,
like shivering in the corner, and
right. Yeah,
mom or grandma's like, "Oh, thank goodness. That was
right.
horrible."
Exactly. Yeah,
And
yeah.
I think that just, again, furthers the idea that like that medicine, science, our knowledge of the woman's body is changing. Like we're spending more time there and we're discovering more. And so even for myself, right? That in mental health, I'm always, you get to take all the CEUs and learn like you do in all the professions. But I was still caught up in like, well, this is what my mom went through. So I'm, like just in this comparison
Right.
factor
For
versus like owning my own
Exactly. Yeah.
space.
You're like, well, I haven't felt so hot. So maybe it's not menopause. I haven't had a hot flash or, I have had this or not that. So,
Yeah.
maybe it's not that. But in the other part, I don't think a lot of people tend to realize is that menopause, it's a spectrum and it's a continuum, so there's not just like this magic age. We can actually be experiencing perimenopause symptoms for 10 years, even before we actually hit menopause. So, and it could be, these other symptoms that we just don't realize that that's what it is.
So Dr. Shayla, that is your intro, right? You're just going over like it's a spectrum. This is a journey, right? Our bodies and everything we're going through your business, your scope of practice now that you're in, where you want to slow down and have more time with the patients. Walk me through. So I've used myself as a guinea pig throughout this series just to give like a perspective, right, of some symptoms that have come
Yeah.
up. So from you, oh, I can't talk today. For you, right? I come to see you, and I'm a 38-year-old female. I can get my own age, and I had a biological child at 32, and now I've found that maybe in the last 6 to 8 months, there's been, you know, increased night wakes, right? With a little bit of night sweats, which I didn't know was that. They're just little beads of sweat. I'm
Yeah.
hot, you know? There's a big energy dump during the day. About the week before my period starts, my partner has tuned me in that I'm a little bit crazy, and I could possibly punch everybody in the face, is at least how I walk around. And then that brain fog piece, right? Where like, yeah, I want to tell somebody to pass me a cup, but I ask them to pass me the pencil that's sitting next to it, you know? And so I'm coming to you, right? To your practice, and I know there's a lot more to this, but what do you do with me? Like, where do I go from here?
Yeah, yeah. So first, we would sit through. I like using intake forms because I like getting the full spectrum of everything that's been going on. So we'll take a look at, you mentioned that you had a baby a few years ago. So we'll, look at, make sure nothing happened in pregnancy that can even be, causing concerns right now. We'll look at, what your work-life balance looks like. We'll look at the types of food that you've been consuming because as the old adage say, we are what we eat. And so that
Yeah.
can make a difference even, and even with menopause, there have been some newer studies showing that there's an inflammatory component to menopause. And
Interesting.
so even our nutrition can play a part in some of those symptoms that we're experiencing. So then we'll look at, movement. You mentioned sleep. Sleep is so important in so many health conditions. You as a mental health person, I'm sure when people are lacking sleep or getting inadequate sleep, it definitely plays a part in our mental health and our physical health. Even in our hormones, in the way that they function and the way that we even produce those hormones. Especially in weight gain. Like I said, I'm also, certified in
Yeah.
obesity medicine. And what we know is that when we aren't getting proper sleep, then our leptin and our ghrelin, they get out of whack. And so that's why we tend to get some of those nighttime food cravings, or we tend to, kind of feel hungry and munch on, little snacks and stuff at night when we typically wouldn't have done that. But because we're lacking sleep now, those hormone levels are out of balance. So we take a look at all of that. And then, after that, then we would check some labs, because sometimes they can tell us some things. So usually when I'm checking labs, I'm not just gonna, dial in tunnel vision and say that, yes, this is exactly what it is. But we want to check your thyroid, make sure that's, functioning okay, because thyroid hormones can also cause some of the similar symptoms. It can cause some brain fog, can cause some weight gain, can cause some sleep issues and mood issues. So we check that. We would check hormones depending on that, especially depending on what your menses were doing as well. You notice some of these symptoms around menstrual cycles. So we would want to know more about that. And then go and see, what those labs are showing, but also looking at it on a spectrum once again,
Yeah.
because, it's not just the lab work, it's not just the symptom, it's all of these pictures together. And then start and seeing what things we can tackle for you, what things that, may be helpful for you. So even, though these symptoms may be menopausal related, but in your situation, maybe just improving your sleep first could improve so many other things before we even get to talking about if you may need hormone replacements or, some of the other medications or other treatments that may help hormonal function. So
Yeah. Yeah.
it's, I would start there, which
Yeah.
sounds like a lot, but
No, absolutely. Well, that's the thing. I think, I mean, again, I said it earlier, but like, there's so much to it because it's the whole story. But it takes me back to like, why haven't, and my own fault, and some of what I do with clients, right? Like, why haven't we slowed down enough to take in like all of these things to see that they're all happening so that we can get the best resources, right? So, like, you can throw all
right,
that stuff at me and I have the space to begin it, you know? So,
right.
you you explained to our listeners, and I read about your plant-based diet that your plant-based scope of practice and journey that you've had. Like, so bring me to that, because that is so interesting. And we haven't had anybody on to talk about that, but especially when it comes to if you feel comfortable, to hormones and just this transitioning through life, bring me into a plant-based conversation about that.
Right. Yeah, yeah, yeah. So I've been plant-based myself for over a decade now. And really, first went plant-based because I had a number of just GI issues. And so
Yeah.
just really healing my own body.
Yeah.
But the more that I've incorporated this into, my lifestyle, incorporated it and helped others with this, I've just seen folks have just so many breakthroughs and so many health benefits from it. And so when it comes to our hormonal health, I talked a little bit about that inflammatory piece that's been found to be associated with menopause, as well as we're coming about, in an era in medical research now where we know even more about gut health and how gut health plays a part in our mental health, how it plays a part in our weight and weight gain and those factors. And so having a plant-based diet can be really helpful for this. Now, usually the first thing people say, well, I gotta go vegan, and I tell them, no, you do not, you don't have to, go throw away the whole refrigerator and go vegan. No.
Yeah.
But the goal is to get more plants on your plate because of the health benefits that you can gain. For example, dark leafy greens. I always like to use this example. Dark leafy greens are really one of nature's natural anti-inflammatories because of the pigments in those dark leafy greens. They actually help to reduce inflammation markers. They actually help to improve cholesterol levels. They actually are high in fiber, so they help improve our gut health and our gut balance. So even if you started with one thing and just, started dumping some greens and whatever, you would go a long way. I like to use spinach. I tell people spinach tastes like nothing if you,
Yeah.
just grab some raw spinach. So you can almost put it in anything. I mean,
Yeah.
and get some benefits there. But yeah, so I talk to my patients a lot about healthful ways of incorporating more plants into their diet so that we can improve their health for longevity's sake as well and help improve those symptoms. Now, when it comes to menopause specifically, there have been some studies that have been done on soy in terms of looking at the plant-based realm. But I will say conclusively, there's no conclusive evidence that will necessarily tell you that, soy is the way to treat your flesh and it's going to make them go away. There's nothing conclusive to tell you that. But we do know on a continuum that by adding plants overall into your diet, it can improve just so many other things to where you will be feeling better overall in terms of that.
Yeah. Okay. So you already, reframed it for me, because I was thinking ignorantly, like vegan, pure, pure from the earth. But so you were just goal being as many plants on the plate as possible. Do you want
Exactly.
ideally raw? Like, are we looking at raw spinach? Do you
And
care?
no, it doesn't necessarily have to be
Okay.
raw. A lot of the research into plant-based nutrition actually came from more Asian populations because within their diet, they tend to eat, the way that they eat tends to be about 95% plant. They do eat some meat, but it's usually a small amount, kind of like a garnish of the meal. Versus in America, we do the reverse of that. We have the plate-sized steak, and then we have this little bitty thing of broccoli on the side.
Hi.
Right, right. So it's really getting us to, make that plate more plants and make that meat portion much smaller, if anything, type of portion on your plate so that you do overall reduce that inflammation, improve your gut health, reduce your risk for cancer, reduce your risk for heart disease. By having these plants incorporated into your diet, into your way of eating, but you don't necessarily have to go march and be vegan, but
Sure.
you can still
Sure.
have your little piece of whatever, but just the predominance of your plate should be.
Yeah. Yeah. Just to be aware. Absolutely. Okay. So I'm slipping on my words here. So when we move on to like other symptomology, right? So obviously sleep is huge. I know in mental health alone, but in my stage of life, that is one of my big symptoms I've brought to the table in all of these recordings is the sleep disturbances, right? Causing then, of
Yeah.
course, huge, I'm sure it doesn't help my mood. It doesn't help the 3 p.m. exhaustion that comes on, et cetera, et cetera. a lot of our listeners have that, but then they also say like, then going into the next night, like there's no energy for, there's no sex drive, right? Because they blame, I don't have any
Right.
energy, the libido's junk, you do want to just eat
Yeah.
junk food. So if we
Yeah.
transition to the sex talk, right? Like so many of my
Yeah.
patients and our listeners are like, what's happening to my libido?
Yeah. Yeah.
What's your perspective of that?
Yeah, so even from the, even rewinding a little bit to go back to that sleep perspective. So what we do know is that that can be definitely hormonally related. And even just adding a little bit more progesterone, because we know, as women, we make estrogen and progesterone. And so those things, when we're going heading towards menopause, those things are going to be lower. So sometimes even adding a bit more progesterone at bedtime can be helpful for sleep if it's, a hormonal thing going on, or even some of our other medications that can be helpful for what we call vasomotor symptoms, which are those like hot flash kind of symptoms.
Yeah.
It's, because if you're losing sleep because you're waking up sweating in the middle of the night, then we do need to improve that,
Yeah.
for you. But then leading into the whole sex drive and sexual dysfunction, that can be contributed to the lack of sleep, but then it also can be contributed to the vaginal dryness that can come as we're heading towards menopause, because when we have less estrogen that we're making, then it causes those tissues in the vaginal area to be a bit more dry, to be a bit more brittle, and that can make it hurt more. And
Yeah.
if you remember the last time you had intercourse with your partner that it hurt a little bit or you felt sore, then yeah, you're not going to be, too fancy to want to go do that again either. As
Right.
well, you're lacking sleep and now it's hurting and you're just like, whatever, let it go.
Done. Yeah.
Right. Right. So yeah, so hormones can help with that. Even just local vaginal estrogen can for sure help with some of those vaginal symptoms if that's what you're having. Now, if it's truly a libido issue and you're not having those symptoms, then there are other things that can help. There was a newer medication that came out on the market. They compare it to like the male Viagra. It is it's not that great, ladies. So don't don't fool yourself. The men,
Uh,
they look out for themselves, but they
yeah.
didn't give us anything that great.
Yeah.
But
That's right.
it can help for some. The
Sure.
medication can help for some. There's a newer medication out there that can help. But really, in terms of libido as well, exercise is something I typically have patients be sure that they're incorporating. The thing about exercise, it's one of those things, I call it like a double-edged sword, because a lot of times we say, well, I'm too tired to go exercise. But when you do exercise, it actually releases those happy hormones and makes you feel more energized and feel better about yourself. And that can actually is the natural way that you can boost your libido, just by, making sure you get in some routine cardiovascular exercise as well, which can also help improve your sleep. A lot of these things
Yeah.
kind of come back to each other. There's a lot of interplay in this.
Yeah, no, that's amazing. You're right. It's like a picture like an onion. Like every layer you peel is connected to the next layer and it's one big you, but that makes complete sense. Okay, so I wanted to highlight, like, while I dove quick into the plant-based part because I love it. There's a lot of our listeners that are so hesitant to head towards, like, even the I don't know if that was an injection you were talking about, but the medicine that's come out that's comparable to Viagra, right? Like so many
The
women.
peel.
Okay, it's a pill. So many women are scared to, or at least the people that are listening and that have written into this are scared to try those next things, are scared to try hormone replacement, are scared to do these, as they call synthetic or whatever the words are. Like, can you give feedback through your practice, because you have a lot of functional approaches, at least I read about, like what you think about all that and how you approach it?
Yeah. So as with anything, there are its pros and cons. I even tell people when it comes to supplements, a lot of times we think, oh, well, supplements are safe. They're so, you can buy them at Walmart, so they got to be safe. No, even those have pros and cons. They can even, cause some toxicities and some issues, under certain conditions. So one of the main things, another kind of going back to that, having more time with my patients, is we actually sit and we chat through all of those concerns, so that, patient feels comfortable and I as a prescriber feel comfortable giving you something, that you're going to be comfortable with. But all in all, a lot of the newer hormones that are on the market, the estradiol, the progesterone, these things are actually very similar to the natural hormones that our bodies make. So, we can take these and we would expect the same side effects that, we naturally would. When you look at the newer studies, even that have been done on hormone replacement therapy, they found that if you start them early before age 60,
Yeah.
so I have to clarify
Yeah.
what
Thank you.
early is.
Thank you.
Yeah, so yeah, before age 60, that these hormones can actually have some more protective effects versus the old school of thought where we thought, that being on hormones can cause so many issues. When we took another look at that in the medical literature, it was over the age of 60 and older women who tend to have more complications and issues related to these. But it's actually been shown if you start them, earlier on in your menopause continuum, then you actually should do better and actually can have some protective factors.
That's amazing.
Yeah.
Yeah. Okay. I mean, if I can switch to that a little bit, like their new literature, and I know there's been some literature in the past. What I keep hearing from everyone, and I understand myself, is there hasn't been much literature in the past or much look into it. So, from your perspective, like what's happened that there's a change and we're talking about it more and researching it more?
Yeah, so I'll tell you. So there was most women have probably heard of the Women's Health Initiative study. So that was the large study that came out early 2000s, but it affected a lot of women's health. I will even, say I came out of medical school in 2007, and even then we were taught, don't give women those hormones. You're gonna give them all heart attacks and cancer. Kind of, was what we were taught.
Yeah. Yeah.
Yeah. And so there came this whole generation of doctors who were just like, okay, well, we're not giving hormones because, we were told not to do it in our training. And so, but now what's happened is going back, taking another look at that initial study, it goes back to what I was just talking about. What we found when you take a deeper look at that study, they actually, the women who were in the study tended to be majority white. They tended to be older. Their, average age was in the 70s, and they tended to already have some underlying health conditions. Those were the parts we didn't realize early on.
Sure.
So, if you kind of look at that, and you leave out a whole lot of other women, out of
Yes.
that. Yeah. And so now, newer studies that have, taken another look at this, where they looked at younger, healthier, more diverse population of women, that's where they've actually found that women who are started on these hormones prior to age 60 can actually have some cardiovascular benefits, can have some cancer risk reduction, can also improve
Wow.
bone density. So some of these other things that we thought were so bad, we've now found out there are actually some benefits to this, and that you don't have to suffer, for the next 10, 15 years because, you're doomed.
Yeah.
Even though I will say I had patients even then who were like, I don't care, give me cancer, but I need these hormones.
Yeah. Yeah. Yeah.
but
Quality of
but now
life.
we have been better. Right. Exactly. Quality of life. Yeah.
Yeah.
And that's
Yeah.
huge. Yeah.
Yeah, absolutely. And I'm so thankful that you went over that. Like just I mean, what from when you graduated 2007 and it's 2024, I mean, that's less than 20 years
Right.
and
Yeah.
just less than 20
Yeah.
years
And how things
ago.
have changed. Yeah. Uh-huh.
Yeah,
Yeah.
that's
And that's the crazy thing about, medicine. And as I'm, in healthcare, things do, they change, so
rapidly.
rapidly. And also while we are constantly learning, I know in my profession and yours too, that, we have to have a continuing education. And that's why, because
Yeah,
things
that's right.
change. There are even some other things that I learned back in medical school that we don't do anymore. So
Yeah. That's right.
yeah.
We have
Yeah.
to we have to go with it. But I think to, while you're absolutely right. That's why we have to take extra training. I'm sure you take way more extra training than me every year, but then to the common ear, right? So my common ear, even being as a woman, because I'm taking so many mental health trainings, right? Is like you get stuck in the old rhetoric, like hormones are going to cause cancer. So why would I go do that? And here we are, these new studies, and it could actually have an opposite effect if taken at the right time.
Right.
Like
Yeah. Yeah. Mhm.
mind
Yeah.
boggling.
And I still remind people, you still want to talk to your personal doctor, look at your personal risk factors. You know, if you've had first degree, your mom, aunts, and several people have had cancer, then yeah, maybe they aren't for you. But, talk to your doctor about it, because there are some occasions where you probably can use, even if it's just, a vaginal estradiol, for example, for some things, because it doesn't go in our bloodstream the same way as a pill does. That can still be helpful for you. So don't feel like, you have to cancel everything out just based on older recommendations.
Yeah, no, that's amazing. Absolutely. So through your practice, because I want to bring in your specialty of obesity, and I think that, and you can correct me if I'm connecting this wrong for sure, but I do have a lot of listeners. I have a lot of clients, right? Perimenopause or not, or menopause or not, there's not only weight challenges and health challenges, but then there's a whole mental health aspect to that, right? Body dysmorphia and just this whole look of ourselves. But through your scope, especially with women in midlife, what do you see being a common theme there? Do you have a lot, I don't know if I'm asking that correctly, but is there a common theme of women in midlife that come to see you, period,
Mhm.
whether it's obesity or
Yeah,
not?
yeah. But when it comes to obesity, right now in America, we know that over 74% of American adults are either overweight or obese. 75%. So, that means
Right.
either us or someone we know for sure, are either overweight or obese. And so that's just where we're at. But when it comes to women in midlife, a lot of hormonal changes our body composition. So a lot of times we see weight gain in our midsection, which is also, though, a lot of people don't realize is a cardiovascular risk factor, the more weight you have in your midsection. So it is important to, be mindful of that and work with your doctor to make sure that, you are improving your weight, and not even just from a cosmetic standpoint, but from a health perspective. And that's really the exciting thing about where we're going in the field of obesity, is that we're no longer looking at weight as a disease of failure. We're not, we know that it's not that people, haven't just pushed back from the plate. That's not what this is. This is a true disorder where the body's hormones, the hormones of insulin resistance and our hunger hormones, things just aren't working properly. And so we know now there are treatment options available, and we can treat that. And so, for women in midlife, so that midsection weight gain, I see a lot of that. I see a lot of the women who just, aren't able to lose weight with those old methods. Back when you were 25, you probably could, just cut back a little bit, crash diet, and,
That's
drop
right.
5, 10 pounds. Well, that
That's
doesn't
right.
work when you're 40, so we
Oh, it
got to do things
doesn't.
a little bit differently, and so those are the kind of things. And then especially, folks who may have children and, families, a lot of stress is playing into that. We know a lot more now about stress and its impact on weight and weight gain. And we know, as women, when you're working full time, you've got a couple of kids at home, you got your spouse, you know, there can be some stress there impacting that as well.
Yeah.
And so those are, 10 kind of the factors that I tend to see with a lot of women in midlife arena.
Yeah, absolutely. And do you see the biggest discrepancy that I'm going to ask again, what is the biggest discrepancy you see? So these women come in with these challenges, and, I know that there's a whole storyline. Like, what seems to be the missing pieces for them? Like, what has been missed, maybe? Does that question make sense?
Yeah, 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 and I can give you one example of
Please.
a patient that I had. So this was a woman who, she actually came in for her hormones. She said, I just feel like my hormones are out of whack. She had done some hormone testing, just outside testing on her own, which we looked over, and yeah, she's in menopause. It's like, okay, yep, you are in menopause, but let's really dive a little bit deeper into everything that's going on. Did the labs like we talked about. Turns out she had early stages of diabetes, which she didn't realize. So some of her symptoms were diabetes related, and they weren't all hormone related. So, I present that to say, even, kind of where we started, it was like, let's look at this on a continuum. Let's not just, box this into one thing. And then, because another thing she had noted was the weight gain that was contributing to that. And so that weight gain had to come to a point, though, where it's now translated into insulin resistance and was feeding this into diabetes for her. So, it's important to look at all of these different factors and tackle these things. And really, for your listeners, really to be working with someone who can help you just, work through all of these different things.
Yeah, that's absolutely it. That will slow down with you, which I know is hard in the
Yeah.
medical world we live in, where it's, just to keep a business going, it's turn and burn. We've got to move it, but to slow down with you. I appreciate, yeah, you giving us a case example, because I think that also helps even for this, right? We've created this perimenopause mini series, but that also does then, even though it's broad, it still scopes it down to being like, this could all be perimenopause, when really you're right. It's the whole you, and we've got to take it
Mhm.
take it all into consideration. What do
Right.
you
Yeah.
see? Oh, were you going to say more? I didn't mean to
No,
overtalk
no,
you.
it's okay. Go ahead.
Okay.
No, it's all right.
What do you see as being a menopause specialist, as you're being menopause certified, like you say, like this transition phase and then menopause? Do you see, since we have a lot of listeners that could be in perimenopause, do you see anything extra? Like, I shouldn't say extra, but anything you would hope that they could be doing to truly embrace where their transitioning body is right now to prepare for menopause?
Yeah, so, from a preparation standpoint, I like
Yeah,
that you actually asked that because, we all are aging every day. We're
that's right.
aging,
That's right.
So so it will come, at one
Yeah,
time or another. That
yeah,
will look different for all of us. But in terms of preparation, I will say just be the healthiest version of you that you can be. What I tend to see a lot from my patients in their 20s and 30s who are preparing for pregnancy, a lot of times they'll do that beforehand. They'll say, oh, I want to make sure I'm healthy so that when I get pregnant, I can carry my baby healthfully. But then as we age more into midlife, then it's like, well, I've raised that kid, so I don't have to, be
forget
on the
it.
straight and narrow anymore kind of
Yeah,
thing. Yeah. But you really want to still be thinking of your body in that way, being the healthiest version of you. Because when we age, we do know that those hormonal shifts are going to come. And we do know with those hormonal shifts, it's going to increase our risk for certain, conditions beyond just the not feeling so well from all of the different symptoms that we've discussed, but even these other health conditions that we can be at risk for with, as women as we age. So just really putting your body in a place to where you're becoming the healthiest version of you. So taking a little bit of that self-care.
yeah,
I talked about, a lot of times especially I see in my practice, the women who, have the kids, they have the business, they're doing all the things all the time. But that self-care piece is so important. So, getting with your girlfriends, going on a trip or going on a hike for yourself, taking a yoga class, learning a new hobby, reading a book, something that's not a not educational book, just a book. you
yeah,
know,
yeah.
Something for
Regular.
yourself. Right, right. Yeah, just really, prioritizing you to be that healthiest version of you. So that when these things start to arise, it also helps you to recognize when something else different is going on. Because if been constantly dealing with so many different health conditions, that's another factor there. Then you may not even recognize that, oh, now, I'm
Yeah,
breaking out in sweats more, or now I'm more forgetful because you've had so many other things going on. So you may not even recognize those perimenopausal symptoms sneaking up on you. But, so do that. Also pay attention to your menstrual cycles. That's going to be so important because some of the earlier menopause symptoms that we can see is that those cycles, they may start to space out a bit. They may come a little bit more irregular. Nowadays, there are some really good apps that you can just, right on your phone. You can just, hit the app and it can
yeah,
even point out to you, hey, this is looking a little off from your usual kind of deal. And so that's important as well to pay attention. I wouldn't tell you how many women I see, I'll ask, well, when's your last period? And I'm like, I don't know, and scratching their head. But it's important to know that
yeah,
because that plays a part. Because the true definition of menopause, and I'm sure probably one of your people you talked to have talked about that, but the true definition is no period for 12 months. And so if you don't even know, what your periods were doing, then, it makes it a little bit more of a challenge to say, did you really go through menopause just yet or not? Just looking at textbook definition. So that part's
yeah.
definitely important as well.
No, absolutely. And I'm guilty of it, going, they're like, when's your last period? And
Yeah.
it's like, I've not been a woman I didn't, like I've never not
Right.
had a period for the last 3 decades or whatever it is. So, absolutely. And, with what you do and through your scope of practice, and the women, and obviously this is aimed for women, but the women that come in to see you and they have whatever it may be, the chronic illness, perimenopause symptoms, these challenges are coming to see you, like, you know, from an empowering woman ideal, right? Like I'm obviously very big into like they deserve the right to, know their health, know their resources, but a lot of times including myself, that I don't have time, got too much to do, all the other women went through this, that mentality comes in. How do you approach that through your scope?
Yeah, I like to tell women to, one, make the time, and two, prioritize you. Don't feel like you have to sit and suffer through, even if a hot flash. You might have say, yeah, or my grandma had those, and it was just a hot flash. So, but don't feel like you have to suffer through that. So actually, go seek help. Make it a priority for yourself, even if it's to a point of where you have to get a sitter, put it on your calendar,
Yeah.
book it out a month in advance, and say, you know what, it's there on the calendar. I'm going to do this thing. But really prioritize you, because if you're not there, then you can't be there for all those other people. So yeah.
Right. It always, and we've said it a couple times in the series, but it goes back to like put the oxygen mask on the airplane, and they're like, put your own on
Yeah,
first because you're passed out on the floor, and then you won't be able to put anyone else's on. So do it,
exactly.
do it first. Absolutely. That's beautiful. What do you think? This is what I've been asking everyone. So like 5, 10, 15 years in an ideal Dr. Shayla world, where is women's health? What do you see?
Oh boy.
I know. Sorry. Loaded
Yeah,
question.
yeah. Well, I would hope within the next 15 years that, one, women have the right to do with their bodies what they want to do with their bodies, where women are, really the decision makers for their bodies, and as crazy as that sounds, we
I
should
know.
be.
I know.
Yeah. And I also see that these discussions, and I love that you're having this discussion, but I hope that it's more just, readily spoken about, so that it's not even considered taboo, especially even sexual health for women. I feel like so long, women were thought to just be, quiet church mouse, not that but we're the ones who have the babies. So there has to be some sex there,
Yeah. Yeah.
So, but
Shocking.
let's more openly, right, talk about these things, because and that's part of our health too. So really, I just, hope over the next, several years that those things, that women have autonomy over their bodies, and that we can openly have these discussions just readily, and they're not even thought to be taboo, so that our, the daughters and nieces of the world are then able to openly, know these things and have these discussions amongst themselves.
Yes. Oh, I love it. Preach it. I love it. What about on the flip then? Just because, I heard some of it in there, but on the flip, like the discrepancies you see now, whether it be in the research, well, yeah, in the research that comes across your desk in regards to women's health, what are the main areas of need that we really need to dive into for women's health? What do you think?
Yeah. Yeah, so definitely menopause research. There definitely
Yes.
needs to be more of it,
Yeah.
especially now that I feel like women are, shouting it from the rooftops, like, we want this. We want to know this about ourselves, and we want, support for this. So I definitely think more research needs to be done, but not even just in the medication aspect of it, but even in the more natural uh realm of it all. Cause I
Yeah.
mentioned about, like, even when it comes to soy, like, the research is done, none of it's been conclusive, but I do feel there's some other things that are out there, even some other supplements that I, have some of my patients use for, I throw out sleep, for example, or ashwagandha, that we may use. But the research is lacking in the department, of these things, especially when it comes to women's health and the support that we can give women, even on some of more of these natural realms as well. And I know with natural medicine, it's not sexy. It doesn't pay a lot. So the
Right.
chances of it getting done are slim, but
That's
but I would
right.
love to see it, you know?
Yeah.
Yeah.
No, absolutely. It's
Mhm.
not sexy. Isn't that right?
Yeah.
That's hilarious. And and that takes me to one more I have one more thing and one more thing for you, but that
Okay.
blend of western medicine and functional medicine, I feel like, and obviously this is my one opinion from our 45 minutes together, but you flow between them so well, at least in the presentation today. Like, do you so many times I'm finding there's either like, as they call them crunchy or whatever, but all the way functional, like, holistic almost, and all the way western, but there can be a blend is what I hear you saying.
Right. Yep, exactly. And this
Okay.
is exactly how I practice.
Yeah.
That's why I call it integrative, because I do. I mesh, modern medicine with the holistic aspect. I may tell you to go have acupuncture for your anxiety, but I may also give you a little bit of Zoloft to go with it.
Right.
So we mesh both
Yes.
together. And really, and it comes back to really me seeing you as an individual. I know that we are all unique beings, and so I feel like I should see you that way as my patient, and that's what we do. What works well for your lifestyle, for your health, what's gonna be something that's sustainable and really helpful for you. And so that's the way that I like to mesh things in practice.
So it can be done is what I want our listeners to hear.
Yeah.
You can have a
It
little of
can be.
both
Yeah, you
and
can.
yes, and be happy and healthy.
Yeah. And
Um
the other key to that, I'll say,
yeah.
Katie, is I like for my patients as well to be an advocate. Even I tell my family members, too. I'm like, go ask your doctor about this, and this. It's like be an
Yeah.
advocate for yourself. I'm one of those doctors. I am not intimidated by you telling me you went and read something somewhere and you bringing me the study. I'm happy to sit through that with you and, give you my opinion, or if I, read something differently, or if I feel you may have misinterpreted something. We can certainly do that. But, I also, especially as women, I feel like we should be able to as well be an advocate for
Yeah.
ourselves.
Yeah, absolutely. Find the voice for it. I love that. I love that
Yeah.
for sure. Is there anything you think, and I know we went all over the place and came back around,
Yeah.
but is there anything that you think that through your scope of practice, I keep saying, but that you think our listeners we didn't go over that our listeners need to know?
Ooh.
And I bet there's a lot, but in
I know.
regards to
I felt like we did. We hit a lot, which is great. I'll just really just bring it home by saying that don't feel like you're out on an island if you are someone that think you may be going through menopause, even if you don't think you're old enough. I do think that's one thing we probably didn't talk about is age, but even if you don't think you're old enough, you still may be because it is a spectrum, it is a continuum. And if you just feel, something's not right or something's off, definitely go seek support, go see your doctor, get some help, and just, tackle it. It may be menopause, it may not, but it doesn't hurt to, look at what truly is going on because ultimately, just bringing that back in, you want to be the best version of you and want to make sure you're the healthiest version of
Absolutely. Whew, you summed it all up perfectly. So Dr. Shayla, how I know, your practice is here in Tennessee. How do you like if especially we have a lot of local listeners too, like how do they get a hold of you? What do you want? How do they find you? And I know you're all over social
you.
media, but tell
Yeah.
us.
Yeah, so I am on Facebook and Instagram under Essence of Health Wellness Clinic, so you can find me there. I also have a TikTok. It's under Dr. Shayla. And then you can find me on the website, which is drshayla.com/EOH.
Beautiful, beautiful. Oh, Dr. Shayla, this was amazing. I appreciate it. Our listeners appreciate it. You've answered so many questions. So we thank you, and thank everybody for joining in today as we figure out this next transition of our lives together. Because I hear Dr. Shayla and many other people saying like we need to be talking about this stuff. This is us
For
together. We
sure.
can, and women plus women trying to get something done is a powerful thing. So I
It
appreciate you
really
being
is.
on today,
That's
Dr.
right.
Shayla. This was
Yeah.
amazing.
Thank you so much, Katie.
Absolutely. And I will cut it. You were wonderful. Thank you so much for my tech challenges.
All right.
You
That's
feel
all
okay
right.
about it?
Yeah, no, I feel good. No,
Okay.
I think your questions were great.
Okay.
Yeah.
All right.
I think it was good. Yeah. So
Okay.
let me know, so that I can push it out to my
Yes,
audience as well.
I
Yeah,
will.
to
I
support.
will. I even do so I think I can probably find all your handles and everything. If I can't, I'll shoot you an email. And then when it is
Yeah,
ready, Riverside, which is this platform that I use, it will make little clips of our interview that you can share on social media. So I'll put it in a Google Drive, and if you need to share that, obviously that's at whatever you need. And you're just really cool. So thanks for all you're doing for
yeah.
everybody.
Oh no, thank you. Now, where's your practice?
I'm virtual. I'm in Chattanooga, but I do right now I'm 100% virtual. So
Okay.
it's
And
all
do you
telehealth.
focus more on women's mental health issues?
Yes. So I'm actually a perinatal mental health certified. So pregnancy and postpartum was my specialty, and it has been, and it's wonderful. But as I'm aging, and a lot of my clients are as well, that have stuck, I'm like, oh, there's more. So this podcast actually was called The Motherhood Dilemma, and we talked a lot about all the things unspoken in motherhood, but we're spreading it to womanhood, because motherhood's one,
Mhm.
aspect of the whole thing. And it was,
Right.
again, that getting too scoped down and blaming, and we wanted the whole broad. And yeah, so then this is just a little series within it, because obviously I'm very curious. Selfishly, I want to know answers. And there's so many cool practitioners and providers out there like yourself. I had no idea. So I'm trying to gather,
You're right.
right? I
Uh,
mean, so yeah,
yeah,
that's
yeah,
what's happening. But I
yeah.
will
Well,
say one
that's
more
what's
thing, Dr.
great.
Shayla. Last year we hosted, my coworker and myself hosted a Beneath the Surface event. It's an event about women talking about things that we don't talk about, and we want to curve that more to midlife this year and talk about things like menopause, sexual health. And so if you're comfortable, I'm going to have them reach out to you if you're interested to come speak at the
You're cutting out,
events.
Katie. I'm sorry.
Oh, that's okay. I don't know why
Katie.
that. Yeah, can you not hear me? Can you hear? No.
Okay,
Okay, hold
now I
on.
can.
I'm sorry.
All I heard was event. I didn't
Okay,
hear anything after.
I'm glad that
Yeah.
didn't go during the middle. Oh, no, all I'm saying is we have a couple events we're doing in 2025 where we'd like providers locally to come and speak. So I might reach out to you. You don't
Okay.
have to, but just in case you get
Yeah.
it through that scope, we would
Okay.
love yeah,
Yeah.
to pick your brain.
Sure. Tell me. Yeah. Just send me more.
Okay. Okay. All right. All right, Dr. Shayla. You go. Have a wonderful week, and I thank you for your time, and I'll talk to you soon.